easiest test known to man. Can you lie back, Nina? Okay? You put them in this position, and you do it with the other knee, and then you see, are both tibial tuberosities in sort of their normal position, or is one of them drifted posteriorly? Do you see a sag, right? And if what an injury to the PCL would cause the tibia to glide posteriorly relative to the femur. So you look for that posterior sag sign. Anterior drawer test is the same position. You just sit on the edge of the foot, grasp behind the tibia, and then just give a nice anterior glide. You can see it, almost see it happening. So your tibia come forward, but it comes to an abrupt stop. Why? Because her ACL is in there and it's working. I'm assuming you've never torn your ACL on this knee, correct? Because it looks like it's doing its job, right? That's the anterior drawer. For Lockman's, which is a little bit more sensitive because the knee isn't in as much flexion, you have to prop the leg over your thigh, stabilize it, reach around the back, and then do the anterior drawer, okay? So it's kind of like a variation of the anterior drawer test with the knee in less flexion. So it's a little bit more sensitive to picking up an ACL tear. Same thing, just drive the tibia anteriorly. Now Slocum's test is basically doing an anterior drawer test with the tibia either externally rotated or medially rotated. And that's to catch postero or antero-medial instability, or if you internally rotate the foot, you're looking for anterolateral instability. Instead of just ACL, you're starting to think about other structures as well. All right, so that's Slocum's test. We did Loci test as well, which is starting in full flexion. This is the trickiest one. You start in full flexion, you get your thumb behind the fibular head, okay? You externally rotate the tibia, and then you just extend the knee slowly while you're applying a little valgus force to the knee, and with the thumb, you push the fibula anteriorly, okay? And what you're looking for here is a sudden clunk or shift. Okay? So just kind of start here, okay, with your knee in full flexion. Get your thumb behind the fibula, okay, and a little bit of valgus force, and then as you straighten her out, you let the tibia kind of, because you've started it out in a subluxated position. Hold on for a second. Are you starting out in a subluxated position and reducing it?
I started reducing it. So
it's reduced, and then you sublux it as
you go forward.
As you go forward, that's right. So if she had anterior lateral instability, what you've done is you've reduced it by putting her in this position. And now what you're trying to do is bring it on, or create it, by slowly extending her knee, pushing that fibula forward with a little valgus force on her knee. And then if there's that sudden shift or clunk, that means her tibia is subluxated. All right? It's a little awkward to do this test, but the idea is that start her in flexion, try to keep a little valgus on the knee, and as her knee extends, let your thumb push that fibula forward. The idea is that as her knee extends, you're pushing forward with your thumb, so that if she's unstable, she's going to sublux. A little bit of shift or clunk.
And just guiding at the foot, not forcing that into internal rotation at the foot.
Right. You start it in external rotation, but then as she extends, don't hold it there, don't force it there. Just let it naturally sort of unwind, right? Let it go back toward neutral. Okay? And then flip over prone. Apley's compression test. Just lean in, medially and laterally rotate the tibia. Be careful not to just twist the foot like this, right? It's the tibia you want to move. And for distraction, again, distraction. Apley's distraction test. And if you want to add a little rotation there, you can, or you can just distract. Okay? Distraction, and then Apley's compression test. Okay, I'll flip over again. Valgus and varus test, very important tests, and ones that people easily make mistakes on, because what you're going to see a lot is, instead of getting a nice clean valgus, right, what happens instead is there's movement of the hip joint. So you got to make sure that they're just good and positioned well, the forces are delivered in a good direction. Valgus test for the medial collateral. Okay, and then I come around here, slide down a little bit, Nina. Okay, that's good. And then do my varus test. Okay, for lateral collateral. Wait a minute. Again, the common mistake is that you do the varus test, and the whole leg moves like that. The hip rotates. So you got to keep the joint, just that front. You want just those frontal plane tilts, varus or valgus. Should be done with both the knee fully straight and the knee slightly flexed 20 to 30 degrees. Okay? And then joint moves. What did we do for joint moves? We did a posterior glide, right, to increase flexion. That was just in this position, hook line position. Anterior glide was prone. Right, so you go prone, Nina. Anterior glide of the tibia prone to increase extension. Okay. And then was distraction supine or prone? Prone, right? And then distraction, prone. And then flip over. And then the other thing we did at the were the patellofemoral glides, which you want with the knee just slightly flexed. Maybe just a towel roll under the knee is fine. Medial glides, lateral glides, superior glides, inferior glides. Patellar glides in any of the 4 directions. Okay?
Clark's test.
Clark's test, right. Just light pressure with your thumb over the superior border of the patella, then do a quad set, Nina, as tight as you can, and relax. So you're looking for grinding or pain. Light pressure, remember, if you push down hard enough, it's going to cause grinding and pain on anybody, okay? Because you don't want to completely block the movement of the patella. You just sort of lightly give a little bit of a light block and then contract the quads, all right? Still allowing it to move, but looking for pain or pressure, okay? Okay.